It is human to be complex
It's human to fight for the cause you believe in.
and in one day feel tired and sad and joyful and vibrant.
It is human to walk away.
We're complex in our makeup, and it's human to be that way.
It's human to feel good, but to also feel bad, to feel scared, to feel frightened, to feel ashamed.
It's human to feel strong and need help at the same time.
It's human, and it's okay.
Mental health really does look different on everyone. No one is ever going through the same thing at the same time. So I'd love it if you could explain some of the broad factors that really go into what makes us who we are in terms of mental health. Is it genetics, work stress, money, grief? What plays a role?
Every single person is unique, undoubtedly. We look at three big headings. One is our biology. And this is where sort of the medical stuff comes into play. What do our genetics look like? Because we certainly know that there are mental health illnesses that are very genetic. They're very heritable. That means they're carried along our DNA somehow. We're still trying to figure that one out. We have some pretty good ideas, but there is a lot of biology involved in behavioral health. The other piece is our psychology. These are our beliefs, our expectations, our personality structure, our self-esteem, our confidence, our coping skills, our IQ. And then the third, last but not least, is our social piece. And that's our relationships, our family, our culture, our peers, our jobs, right? How we relate to our society. The important thing is to look at all three of those big headings, the biopsychosocial model, and tailor the treatment based on what you learn about the person under all of those headings.
Dr. Lisa, I'd like to go to you a little bit. You work in trauma, among other things. Is there trauma that has been inherited because of gender or race or undiagnosed issues?
Yeah, absolutely. That inherited piece we call intergenerational trauma. So you can imagine there's a moment of historical trauma. That's slavery, genocide of indigenous peoples, Japanese internment camps, the Holocaust. And then they raise kids, but they've been traumatized, and it comes through in their own parenting. It comes through in the way that they manage their emotions. And so that happens generation after generation of generation. One of the most important ways that we begin to heal is to acknowledge what has happened.
Dr. Juliana, we're going to switch to you and talk to me about how the physical and mental space is related in the work that you do and also in the world around us.
It's a huge part of my work, and believing Dr. Dom spoke about this as well, of looking at someone holistically. And so when you have that belief system, then you are seeing that there's such a connection between our body health is manifesting and our mental health is manifesting and how they interact with each other. And it's wonderful that I feel like we are living in an era where that is being understood and practiced at deeper levels.
I want to know from all of you, what are your sort of best guess thoughts about how we can best advocate for these groups and others who really need access to mental health care? How can we meet people where they are and make more room?
I think what actually works is when we go to the community and ask them what they need. What does healing look like in your community? How can we support what's already there and functioning as a place of healing?
There are different ways to seek mental health support, that you can see someone in person, you can see someone virtually, you can do groups, you can look at apps, you can join mental health support networks, take courses. That there's just so much more available.
The more we make it okay to talk about. If people say they're having a mental health problem, I think we're starting to pay attention more and say, okay, let's figure this out, because this is important and this is a big deal and this can affect your life in a really, really negative way.
Best thing that I ever did for my mental health is to put my important relationships first.
The best thing that I ever did for my mental health was to learn how my mind worked so that I could work with it. And that was through a mindfulness practice.
I think one thing I've done that's been very helpful is setting boundaries, especially with work, and just being more disciplined about, sometimes saying no when that should have been the answer all along, but I was not always comfortable doing that.
Feeling anxious from time to time is different from having an anxiety disorder.
We all feel anxious every once in a while.
Anxiousness is a completely understandable reaction to stress.
Yet an anxiety disorder is different from occasional anxiety.
You may feel constantly nervous or feel a dread you can't quite shake.
But there's also physical symptoms as well, like an increased heart rate or hyperventilation or trouble concentrating.
These feelings can be all-consuming. They might not go away. They might feel really excessive, and they prevent you from living your life fully.
You might avoid things that could trigger your symptoms, and everything from your job performance to your physical health can be affected.
Anxiety disorders are relatively common. In fact, nearly 30% of adults will be affected by one at some point.
Thankfully, they're also treatable, usually with either psychotherapy, medication, or both.
The first step toward treatment is speaking with a healthcare provider.
Together, you can develop a plan that works for you. In 2020, we lost more than 45,000 people to suicide. That's more than double the number of people who lost their lives to homicides in the same year, which is unbelievable. I think a lot of people may not really realize that. When it comes to suicide, the level of depression or anxiety can be extremely isolating. So let's talk about how we make this a public conversation. How do we talk about this without shame, without judgment? What are your thoughts?
One of the things is us being open to discussing these things. So a lot of times people don't want to talk about suicide because of the fact that they think, oh, if I bring it up, it may put the idea in someone's head, or you may be pushing them towards that. But that's not the case. A lot of times you just need that permission to be able to divulge whatever you got going on with them. I personally dealt with suicide ideations multiple times, and I attempted suicide 3 times. And so when I was doing that, it wasn't from the aspect of I didn't want to be here anymore. It was more so the fact that I was in pain. So a lot of times we have to share these particular stories that you see multiple people talking about, I've been depressed, or I didn't want to be here anymore, or you're having people normalize these specific conversations. That's something that's going to go a long way, because people can resonate with these particular things, because suicide may be passive. Somebody could be in a down moment and be like, I just wish something would take me out, and I just don't want to be here anymore. It could be something just as simple as that. But then also understanding when you have these specific conversations, people can know where to go, who they can trust, but also build their support system around them. And that's what's going to take people a long way, because of the fact that it's going to take a community to be able to address this issue, because you can't live life alone.
How might someone recognize if they're having a mental health emergency?
You feel like you have no other option. And and you feel like you don't want to be here anymore, and you have a plan and intent to execute that particular plan. You need to get help. And that's not even just calling a friend or a family member. It's also reaching out to your behavioral health center, or maybe even going to the hospital. It's okay to go check yourself. I've actually been in hospitals before, as a patient, but then also as someone who's serving someone there. So you can it's not a death sentence for you to go get that particular help. And then understand if you don't have any way out, or if you have means to, die by suicide, get those things out of your house, or, remove those things from your periphery so you can, be safe. But then also talk to someone. You again, can't reiterate that enough. Is, telling your supports, what you have going on in your mind, what's going on in your head, but then also letting them know that, if I, send a message and I need you to come immediately, creating those plans, be preventive instead of reactive.